Neurotransmitters. So to start off with few questions, what is dopamine and where are the disorders it is changes? So next question is, what is acetylcholine? Acetylcholine, what is it? Next question is, what is glutamate? And tell me the conditions and the functions of this neurotransmitter. So we'll find out the answers to these questions and learn a lot more in this video. So first we are going to read about the serotonin. So what is this serotonin? The serotonin, the major source. So what is the source? So major source of serotonin is nothing but the midline raphe nucleus. It is nothing but the midline raphe nucleus. And what is the function of this? So the function is that there is inhibitory function. So this includes the regulation. This includes the regulation of the mood as well as the sleep. Next, also the appetite and the sexual behavior. Next, also the decreases the anxiety. Other thing to note is that there is inhibition. There is inhibition of the dopaminergic function. So where is this serotonin increased? So increase of the serotonin is seen in case of the serotonin syndrome. Next, we look at the important drug, that is the dopamine. So this dopamine is the major source being the substantia nigra. So it is seen in the major source of the substantia nigra. And what are the functions of this dopamine? So the function is inhibitory. That is in case of the motor movement as well as the alertness. Next, also in case of the reward seeking as well as the pleasure and motivation. Next is the major neurotransmitter. It is nothing but a major neurotransmitter present in the basal ganglia. So where is this dopamine increased? So the increase in dopamine is seen in case of the schizophrenia. It is also seen in case of the OCD as well as in case of mania and the delirium. Next, we look at the endorphins. So the endorphins are the sources, the pituitary gland. The pituitary gland. And what does it do? So the endorphins, it helps in the pain control. It does pain control and also the feeling of pleasure. Also the feeling of pleasure as well as stress reduction. It is nothing but a natural opium. So it is increased in case of endorphins, increased in case of the addiction. So endorphins are increased in case of the addiction. Next is we look at the acetylcholine. So acetylcholine, the source is, it is seen in case of the nucleus bacillus of Maynard. So nucleus bacillus of Maynard is where the acetylcholine is seen. So next is the function, that is it is excitatory. And for the motor movement, excitatory for the motor movement. Then also the learning as well as the memory. So this is seen in case of where it is increased is the Parkinson's disease. It is increased. Next we look at the GABA. So the GABA, what is inhibitory is there is a decrease. There is a decrease. This is in the anxiety, decrease in the anxiety, as well as it reduces the insomnia. Other thing to note is that it interacts. It interacts along with the dopamine. So it interacts with the dopamine and inhibits the dopaminergic neurons. Inhibits the dopaminergic neurons. So the next neurotransmitter we are going to look at is neurotransmitter is the norepinephrine. Norepinephrine. So the norepinephrine, the source is the locus ceruleus, and it is nothing but it is excitatory. And what it does is it fight or flight. Fight or flight. So the function, it is increased in case of the mania. Then we look at the glutamate. So glutamate, the function is it is excitatory, and what it does it links between the it forms links between the neurons. This is for the learning as well as in case of the long-term memory. So glutamate is increased in case of the seizures. So now we are going to find out the answers to our questions. The first question we asked was, tell about dopamine. So the dopamine, the source is substantia nigra, and it is inhibitory. The function is inhibitory, and what it involves is it is involved in the motor movement as well as the alertness. Next, it is reward seeking. It is reward seeking as well as it is involved with the pleasure and the motivation. Next is it is a major neurotransmitter. This is in the basal ganglia. So where is this dopamine increased? So the increase was seen in case of the schizophrenia. There is OCD, there is mania, as well as in case of the delirium. So this was all about dopamine. The next question we asked was, what is the acetylcholine? So the acetylcholine, the major source we saw is the nucleus of the bacillus. This is of the Maynard. So what is the function of this acetylcholine? The function of this acetylcholine is that it is excitatory. It is excitatory. So it involves with the motor movement as well as in case of the learning and the memory. So this acetylcholine is increased in case of the Parkinson's disease. Lastly, we look at the glutamate. So the glutamate, the function is it is excitatory, and it forms links, and this is between the neurons, links between the neurons of learning and the long-term memory. So where is it seen increased? The glutamate is increased in case of the seizures. Now we'll be asking more questions to be answered in the comment section. So the first question is, what is GABA? What is the source of GABA? And what is the functions of GABA and where it is increased? Everything about GABA. The next question we want to ask is, talk about norepinephrine. The same thing, that is the source. We want to know the source. We want to know the function, and we want to know where it is increased. The third question for the comments is, what is serotonin? So here the source, the function, and where the serotonin is increased. So we want these answers in the comment section.